Well, thank you so very much, Mr. Chairman. I'm glad to be here and glad I could get on the internet to address the issues facing our caregiving economy. Um, I've long been a big supporter of Medicaid expansion. Medicaid is the primary source of coverage for long-term services and supports in the United States, accounting for 52% of all spending on long-term care nationwide. The majority of the spending goes towards the Home and Community-Based Services Program, HCBS, which typically involves assistance with activities of daily living like cooking, bathing, other types of housework. These critical services enable aging individuals and people with disabilities to remain in their own homes, to stay active in their communities, to lead independent lives instead of moving to institutional settings, since most Americans would prefer to receive service and supports at home. Ms. Pooh, as you know, unlike nursing home care, state Medicaid programs are not required to cover HCBS care at home, which means the kind of at-home care Medicaid recipients can get from this program varies from state to state. Can you speak to how this patchwork leads to gaps in coverage across the states?
Yes, thank you for the question, Senator. The fact that home and community-based services, unlike facility-based care, is optional and not mandatory. It means that states can cap how many people they serve and limit the types of services offered. And this leads to some states having long waiting lists and families not being able to get the full array of supports and services that they need. And even if they get pulled off the wait list, they may still not get the services that they need. And that, in addition to variation in pay and protections for workers that provide home and community-based services, leads to a system that is complicated to navigate, leaves many waiting with nothing, and some without what they need. And in Georgia, for example, there are 8,000 people on waiting lists for this very reason, Senator.
Right, right. And it's an issue I've been working on for a while and continue to work on. Can you speak about what Medicaid expansion in Georgia and in the other 11 states that have yet to expand Medicaid, what would Medicaid expansion mean to providers, and how would that benefit home care workers?
It's incredibly essential. It is so well documented that Medicaid expansion will improve access to healthcare, health outcomes, increase financial security due to the reduction in share of health costs. It will improve economic mobility because it's easier to go to work or to look for work. For example, adults in Ohio and Michigan reported that the coverage via Medicaid expansion made it easier for them to look for work or go to work. And 16% of home care workers lack health insurance. 43% rely on public health care coverage, most commonly through Medicaid and Medicaid expansion. Medicaid expansion under the Affordable Care Act would benefit more home care workers, providers who rely on Medicaid for their health insurance.
So providing care would actually enable people to work, which is an interesting observation, where we have folks putting the work requirements as a basis for getting the care. And you're saying getting the care actually enables people to work. Is that correct?
Absolutely. That's right, Senator.
Thank you so much.